Hello everyone, I'm Dr. Denson.
And I'm Dr. Cope. We're both dentists. We'd like to take a few minutes to explain dental fillings.
A filling is what a dentist uses to fill parts of a tooth that are missing either due to decay or fracture. There are several materials a dentist can use, but we will stick to only two of the most common: silver and white fillings.
Silver fillings have been around for over 150 years, and the majority of people today have at least one silver filling. Silver has a proven track record, and some of these fillings can last decades when used correctly. These fillings are made of a combination of silver and elemental mercury. The silver gives it strength, and the elemental mercury allows the filling to be malleable at first, then harden after it has been placed in the tooth.
Now don't fret, the mercury in silver fillings is safe. The fact is, most elements can pose some danger to us unless combined with other materials that make them harmless or even necessary to our bodies. Take chlorine for example. Alone, chlorine makes a very poisonous gas that can very quickly kill us. However, when combined with sodium, chlorine becomes sodium chloride, which is harmless table salt. Harmless, that is, unless you have high blood pressure. Then you better use it sparingly.
That's right. It's the same with mercury and silver fillings. Mercury by itself is a no-no, but when combined with silver, the mercury is harmless to us and actually effectively helps in preventing dental disease and infection. There are actually some instances where a silver filling is the only type of filling that is able to be placed due to the location, depth, or size of a dental cavity. If you have silver fillings that are still functioning well, with no decay or cracks, it may be best just to leave them, rather than disturb the tooth needlessly by removing and replacing the filling. As dentists, we put in a ton of these silver fillings, and yet, strangely, with even all that exposure, we're still alive and well.
It would actually make us a lot of money if we told people to replace all of their silver fillings no matter what. But we don't, because they're safe and generally effective. We do recommend replacing silver fillings, however, if our patient is concerned about aesthetics enough to want a white filling instead of a metal one, or if there are cracks or cavities underneath them.
The other type of dental filling we're discussing is composite fillings, also known as white fillings or resin fillings. These tooth-colored fillings are a little more technical to place for the dentist, and they use more expensive materials. As a result, they're a little bit more expensive than silver fillings.
If you've ever been to the dentist when they use that small flashlight to shine on your teeth when filling a cavity, you're probably getting one of these composite or tooth-colored fillings. There's a special molecule in these materials that cause the filling to harden when we cure the filling under that intense light. As soon as we do that, the filling is as hard as it will ever be. We make a few adjustments to make sure your bite feels normal, and you're ready to go.
I've noticed a trend in my patients to want to leave a tooth until they start feeling a lot of pain, or until the tooth just starts breaking off in little pieces. I really try to advocate prevention when your mouth is at stake. A small, relatively inexpensive filling that's placed now may save you from literally thousands of dollars down the road, not to mention pain and infection.
For more information about other types of restorations a dentist may use to fix your teeth, check out our other videos. And thanks for watching.